When I first started my practice in 2020, I started seeing a lot of long-haul COVID patients with post-concussion syndrome, and that's what kind of took off the practice because I was seeing a lot of dysautonomias and those sorts of things with it. As we're in South Dakota, word of mouth goes around, people know each other. I'm from a small town in South Dakota, New Holland, South Dakota, really small, town of 60, related to 40, which is a fun fact about Dr. Cooper. As word got around, I started taking in whatever cases were brought to me. I started seeing an awful lot of kids with ADHD and focus issues, and I would do my exact same exam that I would do on an adult. I would check the eyes, check the balance centers, check the neck, see how the coordination was, and I was finding all sorts of deficits that were the exact same. These kids were getting medicated for underlying neurological dysfunctions and deficits. I started seeing results with focus and attention and emotional regulation, and kids were doing better in school, and families were a lot happier because those kids were a lot more emotional regulated at home, and they could see the potential that they knew was in their kid. They're starting to see that a lot better after doing the therapy. If you've been diagnosed with ADHD right away, like in the early phase of this, and been told to take medication, you gotta start with an exam and try and look at the deficits first in the brain. You gotta at least rule it out. Are there primitive reflexes that are still active? Are the eyes tracking? Is the balance good? Like, you gotta see the brain, if you think of the brain as a muscle, how strong is that muscle right now? Because for an example, like if primitive reflexes are still active, if you look through the symptom list of some of these primitive reflexes, and those are supposed to go away in the first 2 years of life, if those primitive reflexes are still there, every single one of them, a symptom is ADD, ADHD. I'm a parent as well. Like, you want to take a non-invasive approach before trying a medication because that can affect a lot of different systems in the long term. So doing a non-invasive therapy plan, or just starting with an exam and pursuing a care plan that's non-invasive, can be a great place to start with a kid. Primitive reflex is a reflex that is housed in our brainstem, and we're born with them. It's kind of a weird example, but if a deer is born, the deer knows how to walk, and that's reflexive. Like, it didn't watch mom and see how to walk, right? When we're born, we have reflexes that are integrated into our nervous system, into our software, to basically, like, a moral reflex is gonna allow us, if we like move too fast backwards, like we're falling, like we'll start crying as a baby and feel like kind of scared. Cry for mom and cry for help. There's sensory reflexes like on the face, like if you kind of swipe your hand across here and you'll move that way, that's for breastfeeding and those sorts of things. And then there are Babinski reflexes or plantar reflexes on the bottom of the foot that'll keep us in the crawling phase long enough before we start walking, because you don't want to walk too early either as a baby. If those reflexes are still there after 2 years, that can create a lot of issues later. It'll create a lot of fight or flight in the brain that's not necessarily supposed to be there. So say the kid is 6 or 7 and they're in school and they can't focus and they're gonna be naughty in class and stuff like that. I like to think of their perception thinks that there's a tiger in the room because they have so much fight or flight in the brain. It's not that there's actually a tiger there. Perception thinks there's a tiger there. So as we start kind of erasing some of these stressors on the brain, taking the primitive reflexes away, getting the eyes tracking better, getting the balance better and the coordination better, start erasing that tiger out of their perception. And then they can start focusing on the things that are at hand, like the frontal lobe activities, like reading, focusing on what the teacher's saying, doing homework, and those sorts of things. One of the questions that I get the most in the office is like, why does my kid still have these primitive reflexes? The obvious one, like the easiest one to communicate, is a concussion. If the kid hits their head, then you can see some of these, especially in those first 2 years of life. If the kid hits their head, that can kind of slow down your development. Another example, if a kid gets really sick or has like some sort of viral sickness, like during their crawling phase, they're not gonna move as much because we are developing at hyperspeed in those first 2 years. So even like it can be detrimental to not be able to crawl much like during those 2 weeks while you're developing those centers.
Hi, I'm Dr. Natalie Haken. I grew up and born and raised in South Dakota. I attended University of South Dakota and went on to study chiropractic school at Northwestern in the cities. What drew me to pediatrics specifically is I love working with the younger population and knowing that any change we can make to make their life easier at this age and stage follows them and impacts the trajectory of their life. So like many other chiropractors, my healthcare journey has impacted my decision to become a chiropractor. So I had some significant health struggles in middle and high school, and that led me to seeking out chiropractic care. I actually had a professor in college that said, do you know that some of the things that chiropractors can do? And that kind of took me down a route, seeing some other specialists that looked into functional medicine and applied kinesiology and things like that helped me tremendously. And then that got me searching for what else is out there. Like, what about the brain? What could we be doing to impact that, to influence that? I got in touch with Dr. Cooper, and that changed the trajectory of my career as well. Once you learn about functional neurology and the impact on the organ that controls everything can have on your body, and how you can influence that through therapy, and looking at the different systems that impact attention, focus, balance, all those things. You can't unsee that, and you have to learn that information. And so just me specifically knowing the impact that optimizing these systems can have for kids was just a driving force. And so I had to continue to learn everything I can about that. Something that you can't ignore once you understand it is how the eyes impact our ability to focus. How our eyes working together as a team to track as we're reading, as we're driving, as we're playing sports, as we're running, as we're walking. So if you understand that the eyes can impact all those systems together, you have to learn about how to get them to work better as a team. My interest in working with a pediatric or a younger population stemmed from my own exposure to post-concussive syndrome. So when I was in middle school, I had some significant concussions, multiple right in a row, and at that age saw the trainer, kind of did the traditional medical route, which is important, but also nobody knew what to do with me when I wasn't getting better. I was still struggling with light sensitivity, focus issues, headaches, just academic struggles, things that I had never struggled with before, and nobody really had answers for me. It made me super passionate about wanting to learn how we can help other people that have struggled or that are struggling with symptoms like that, either from a concussion or from birth or struggles that have followed them for many years. ADHD is something that a lot of kids are getting diagnosed with at an earlier and earlier age, it seems. The traditional medical route is to treat the child's symptoms with medication to try and suppress the hyperactive feelings, the impulsivity. Here at Brain Health and Chiropractic, we look at addressing the child's symptoms from how their brain and body are communicating. So looking at how the eyes are working, how the postural centers are working. Do they have primitive reflexes that are impacting their ability to focus every day? Hemispheric imbalances that could be impairing coordination and things like that. And we just try and do a whole body approach and determine what systems we can be improving that will help promote focus and coordination and attention and help behavioral regulation. When a child comes into our office, one of the first things we do is an initial exam. And that initial exam looks at how all the systems in the brain are working together. So how the eyes are working, how the balance centers are working, how the primitive reflex systems, are they integrated, are they not integrated, are they affecting one side, are they affecting the other side? And from that long and comprehensive exam, we have a really good picture about what areas of the brain we can be optimizing, and we base our treatment plan upon that. When parents often come in and bring their child in for an exam at Brain Health and Chiropractic, their biggest thing is, I just want to know if we can make things easier for my child. Oftentimes they're just frustrated. They know that there's like a missing piece or something. They're wondering if there's something that we can do that makes everyday life and academic learning easier for their child. And we just want to let them know, absolutely there is. Something that we often see for parents, just changes within their child, is their ability to feel more calm in everyday life, feel like there's less stressors in the room, and that can so impact a child's overall demeanor and behavior with life. The results that we have seen in kids following our intensive therapy include just better emotional regulation. Some parents, often one of their complaints is, my kid just has a short fuse, and all of a sudden they can make it through the evening without an outburst. We can do our homework with less battles. We can sit through a day of school without being so frustrated, things like that. And just knowing for parents that there is hope, things can get easier for their child, and that there is hope for better functioning and just easier days for your child ahead. Emotional regulation is the body's ability to feel calm or feel grounded regardless of the environment surrounding them. So a lot of our kiddos with ADHD often feel overstimulated really easily. And so just being able to understand that from their perspective, there's a lot of stressors that are upregulated or that bother them more than other people might experience these same stressors. And so being able to downregulate or being able to improve their stress response, we kind of give the example of takes the tiger out of the room, takes the big stressors out of the room so that they can regulate a little better and be able to focus and feel calmer inside. When we lack emotional regulation, it means that perhaps our environment is causing us more stress than it might for the average person. One thing that we see in a lot of kids is something called a Moro reflex. A Moro reflex is a primitive reflex that's present in babies as a survival reflex, and when it's still active in kids, it means their body is more likely to always be in a state of fight or flight. It's called sympathetic dominance. And so if we can get rid of that reflex through different mechanisms of supporting the brain systems, it can help kids have better emotional regulation and feel less stress all the time. When parents first come in to see us, some of the biggest challenges that they see for their child is just sleep issues is one of the big things. Inability to either fall asleep, stay asleep, or wake up earlier than they should, just kind of always feeling restless. One of the biggest improvements we see is that first week or even during therapy is their child just feels more grounded, less stress response, better sleep quality, better sleep promotion, sleeping a little bit longer, and that works wonders for setting them up for a better day, right? Another struggle that parents often notice in their child that they just want to see if we can improve is coordination. Some of these kids, they're trying so hard, but they're just a little bit awkward in their bodies, feeling uncomfortable in their bodies. And that can absolutely make sense why they would feel hyperactive or on edge all the time. And so that's something we also notice in children pretty early on, is their ability to just have better control over their bodies, feel more grounded in their bodies, and feeling their bodies is a big deal. One of the biggest reasons for impulsivity, kind of restlessness, is not being able to feel your body or feel grounded within that. And that's something we're really working on intensive week and through our treatments here. With the kids we see in our office, another frustration that a lot of parents come to with us is difficulty with fine motor coordination. So tying shoes, buttoning buttons, writing, fine motor skills with our fingers. And that's usually not something we chase because primarily we want to support the gross motor systems, because oftentimes if we have difficulty with fine motor or smaller tasks with our hands, we have an inability to control our postural centers and feeling our body as a whole. As we work on gross motor systems, it does improve fine motor systems and hand-eye coordination, and that's a big change that a lot of parents see following our therapy. With ADHD, often another common complaint within our parents is their kids have difficulty falling asleep. They're too wired and tired to fall asleep at night, or we wake up frequently, or we wake up earlier than parents would hope, or earlier than expected. We would hope we could sleep through the night without interruptions. And that's a big change that some parents see early on in our care, is just a change to their sleep habits. And if you think about the big change that can create for the trajectory of the rest of your child's day, better night's sleep, better emotional regulation, and that's how better sleep can impact the whole day. So our eyes' ability to stay stable and work together as a team has a large impact on our ability to focus. And if we're not addressing how they work together as a team and how they move together, such as for reading or eventually for driving and things like that, the ability of them to stay on target and work together has a huge impact on focus. And so if we can improve the systems that cause more stability within the eyes, that regulates, or that translates into better regulation of being able to stay on a task.